Welcome, everyone. This is the GRRSP second session for our batch number 7. And today we will be starting off with the topic of research ideation. So that is the process of building your research idea, your research topic, and giving you certain tips, tricks, and techniques on how to narrow down your research idea. At this stage of when this video was recorded, or research scholars were expected to come up with some topics, some ideas. So this will help streamline some of that thought process. Today's objectives are centered around understanding the approach to research ideas, as well as touching a bit on the do's, the don'ts, what to avoid when you're thinking of a research topic and idea, and some examples of published ideas so you know what a successful model looks like in terms of research ideas. And then we'll conclude with an open discussion where all of us come together and share what we've worked on so far. So when we start with the topic of research ideas, the first question is, where do they come from, really? I mean, you've got many sources of research ideas. For some of you, it may be through clinical settings. You might be working as a resident, as a medical student, as an intern, or at any stage of your career. So you're looking for certain challenges, problems, trends that you're noticing within your patients in a hospital setting or a clinic setting. For some of you, it may be looking at existing literature. So this might be your general reading when you're coming across research papers and finding certain gaps in research. The other ways in which you might get those ideas as a source would be through scholarly discussions. And that's where having such research programs and sessions or having any discussions with your faculty members or professors might be another way of getting those ideas out. You've also got personal experience, which is often forgotten, but has a very powerful presence in research. So looking at anything or any topic in terms of medicine that affected your life personally or someone you know, be it your family, your friends, sometimes that can be a strong motivating factor for building a research idea. And then you've got society in general. You're following trends and big news that comes up in society, especially in the realm of public health, pandemics, anything that is of extreme relevance at this stage in research. So that's another source to keep a lookout for. And last but not the least, you've got your own previous projects that may have either died down due to any challenges or barriers. So it's time to bring those back and see either they may require a bit of polishing, a bit of refinement, or just directly adding them to your source of research ideas. So as you can see, there is no one way or right or wrong to get sources of research ideas coming through. So the process of having these research ideas is, in a very simple way, can be divided in 3 ways. You come up first with ideas and themes. So you're looking at, for example, a certain idea of a challenge around you, and then what theme does it fall under? This theme could be a specialty, a field, something within healthcare or outside healthcare. And then you try to narrow it down into how I can frame a research question around it. And that's something we'll discuss in the coming slides as well. And once you've formulated the research question, you add in a few things, you remove a few things, you have a bit of discussions with your seniors, and then you finalize your research topic. So as you can see, jumping directly at the research topic might make you miss either a crucial idea, or maybe the way you question the topic might not be correct. So it's good to follow a structured approach, even if it's very obvious and simple to you. So the process, I like to look at it as a 4-step process, really, when you break down how you start from having a research idea to bringing it down to a topic or a question. So the first step would be to brainstorm, really. And it has a bit of a freestyle approach in the beginning. You look at everywhere around you. And we've talked about sources. So you look down around you at what sources are available. You look at literature as well. And this way, you cover the scientific base as well to your idea, how relevant it is to the scientific community. And we're looking at different sources here when it comes to literature. Some of you may be aware of PubMed, but there are more sources in terms of literature. So you can consider Google Scholars. You can even consider authentic news reports from health organizations like WHO, UNICEF. So a lot of my ideas have actually come through what the recent updates have been from the World Health Organization, especially with papers that revolve around public health. So there's not one source here, but if you can at least narrow down to two, such as PubMed, Google Scholar, maybe a news report, you'll be covering most grounds of what your research idea needs. And then you're looking at applying the PICO framework. So we're going to look into how can you break down your idea into population, intervention, comparison, and outcome. What it means that whatever idea you have, does it apply to a certain population? Does it apply to a certain exposure that it may require? And this could be in the form of a medication or a disease, anything that is intervening inside as a target onto your population. And then a potential comparison, whether if you're comparing this idea with another country or another disease or another medication, that's another thing which can make your idea more unique. And then the outcome, what are you really looking at? What is the impact of your idea that's coming out? So that's in a very summarized way, the PICO framework. And not all variables might apply to your PICO framework, but it's good to consider these early on when you're building your idea. So your idea isn't too general, too open-ended by the time you reach the research question. Step 3 is the research question itself, and we'll go over that as well. And then finally, refining the question. So as I mentioned, your step 1 is looking at PubMed, Google Scholar, news reports, anything that may be a scientific basis for your papers that exist online. And this is something we had identified earlier as well. When we talk about research ideas, the literature, when you try to search, it's huge. It's thousands of papers around a certain topic. It could be in cardiology, it could be in psychiatry, and you're often left looking through papers where you don't know how to filter it down. So a good way to look at it is consider the research gap that you're trying to get to. And a good way to understand how I can select the right papers that I'm searching for when I'm using PubMed or Google Scholar is look at what is the motivating issue. What is the reason for why this topic needs research? And once you have the main problem, the research topic in your head, try to look at key terms. So for example, my topic might be around why COVID-19 among patients with mental health disorders might have a different impact. So I'm looking at key terms like COVID-19, mental health disorders, maybe a certain population like USA. So try to, before you search, think of key terms when you're searching, because often we blindly write down in PubMed and Google Scholar, and then we're given too many papers than what we need. So you've identified 3 terms, maybe 4 terms that will go well with your PubMed search, and then you conduct the search. So when you search and do a literature review, you look at issues that are not addressed in the literature. So you will look at maybe the top 5 papers, the top 10 papers that are closest to your problem, that may have tried to work on it in a different setting, in a different country. And that's how you choose what papers you'd like to read. Essentially, we cannot go through 100 papers reading them together. So you look at and try to read those 5 to 10 papers. And what am I looking at when I'm reading those papers? Well, you're looking at any issue that wasn't addressed in that paper. Maybe they looked at a certain age group which hasn't been covered in your problem yet. Maybe they're looking at a certain disease that isn't covered in terms of its subtype. So what do they lack when they did that study is what you can cover as your research gap. And a bit of a bonus here where while you're reading that paper and you're looking through the literature review, try to go into the discussion section where often they try to focus on the future direction of their research. So this is a nice section to look at direct ideas they may suggest to future researchers who would like to work on this topic. And they will give you direct ideas on, future research should focus on having a larger patient sample from this country or lower income countries, for example. And that will give you a great richness to your idea besides the main problem. So we talked about the research gap and how you try to narrow down your literature search when you're looking at it. And by now you've maybe reached the stage where you know what your problem is and you're trying to frame it under a research question. So this is where we talked about the PICO framework. So you look at, as an example, patient population being children, an intervention being a medication like acetaminophen, and then a comparison group perhaps, which could be comparing it to a similar medication or a completely new drug that has come up in the market. And then the outcome. So the outcome could be fever, it could be sepsis, it could be psychosis. You're looking at different, clinical outcomes that might come out. And then you bring out your research question. So in this case, the research question was, is acetaminophen or ibuprofen more effective at reducing fever in children? So if it wasn't for using this structured framework, you might actually just say, is acetaminophen more effective in children? And you may have missed out children, or you may have missed out the medication comparison, or maybe the outcomes such as temperature or fever. So follow a systematic approach when you're building that idea. And currently you may have some ideas already, so you can try fitting them into the PICO framework. Another way to cover more variables in your research question is to consider the finer criteria. So the finer criteria looks at feasibility. So in terms of my study, is it feasible in the number of patients that are involved, the number of potential subjects, the time, the funding it might require? So this is something to think of, because maybe your idea might not be feasible in a 6-month time frame, or a 3-month time frame, or even years if it's a randomized control trial. The other thing is the interest. So who is this relevant to? Is this relevant to healthcare? Is it relevant to other researchers? So if it's not interesting to them, chances are it's not going to be of interest to journals either. Is it novel enough? When we think of novelty, that's when you look at what has been done in terms of the current question, in terms of existing literature, what else could be required in terms of the making it different from existing studied. The ethical aspect is very important and often forgotten when we look at research, and this is where you want to avoid certain things and include certain things as well. So you're looking at gender, you're looking at certain cultures, certain systems. So am I being inclusive enough in my idea? It might be too vague, and I want to maybe focus in terms of the gender, or maybe a certain subpopulation in a country. So that would, I think, in addition, make your topic even more unique to journals. My papers often try to focus on the lower income countries standpoint, and that becomes very interesting in terms of publications and bringing it interest to the journal. And then relevance, which is, how much will it advance science really? Am I just looking at an idea for the sake of curiosity, or is it going to really make an impact in terms of patients and health systems in the future? So we've covered how you could have your main question, the theme itself, and then bringing it down to certain criteria, certain tips that can help it frame a question. But a topic in research is never really perfected. And I think that's why you cannot be at peace with it at this stage when you're trying to build it. So it's okay if that idea on its own is not at 100% where you'd like it to be, but to start somewhere using certain examples is also another way. So we're going to show you a bit of examples that we've published so far over the past years at GRRSP. And what we're going to focus on here is the different kind of research methodologies which you can be familiar with during your idea. So your idea may focus maybe in the format of a systematic review, or maybe a clinical research in the form of a prospective cohort study. So you're looking at different methods. And once you have a research question, that's another important thing to think of, where what kind of a study am I going to use to make sure that my research idea is a full study publishable. So the first example we have here is critical care practices in the world. And this is the results of a global intensive care unit assessment survey done in 2020. This is a very nice idea for someone who's looking at answering a survey-based study here. So what we did in this particular questionnaire is we looked at a cross-sectional study, and that's a word you would be familiar with during the course of this program as well, where a study done at a certain point in time that tries to address a research question. In this case, the research question was identifying critical care and ICU needs around the world. So often around the world, we've got different practices in the ICU, and what are their needs? What are their strengths? That's something that wasn't explored enough. And we decided to make a survey on that. And that in the end became a global survey covering 32 countries, 130 ICUs in total. So this was a promising study, which through survey and online approach of sharing them could become a paper that you could write in your own field of interest. A second idea for someone who's interested in technology in healthcare, digital health, is a topic like this one, where again, we looked at a questionnaire-based study. And the idea was to look at a topic like artificial intelligence and what is the awareness and readiness among medical doctors and students when it comes to this technology. How much do they know about it? So we designed a questionnaire, and using existing literature, what exists, maybe even using examples of other questionnaires that are published out there. And we create our own study. And then again, you disseminate it using online approaches without having to visit hospital facilities or going through an extensive channel of networks. So that's another way to publish a paper, using questionnaire-based studies. Another format of looking at especially clinical outcome-based studies would be a paper like this one, where we looked at the prevalence of low birth weight in children who were diagnosed with neurodevelopmental disorders. And in this case, as you can see, it became more unique because we brought it down to a certain city or a certain country. So a topic may be published somewhere else, but that's okay, because you have the chance to do it in your own country and it will still be unique. So in this case, this particular study followed an approach where you had to go through data collection, which often takes a little longer in terms of the process of getting an ethical approval, having someone who could be present physically at the hospital facility to collect data. So it's good to keep in mind of the feasibility of the study in this case. Another example, which is often a very smart way to publish, I would say, especially in places where you're looking at a very restricted time frame. Perhaps you require a publication early on and you're short of time. So we'll be talking about the research pyramid itself, but lower down that pyramid in terms of research impact are commentary papers and editorial papers. So these are papers that share a unique perspective. It can be an opinion, it can be on a topic that's very upcoming in the field of science and of interest to others. Maybe it's something that hasn't been researched enough yet. So there are two examples here, and these are both published in PubMed index journals of different levels, one in the Lancet Respiratory Medicine. And we looked at a certain topic, for example, the rise of monkeypox, and what are some lessons we could learn from the COVID-19 pandemic to mitigate new global health pandemics. So this did not require any patient data. It did not require any ethical approvals. It simply required structuring a nice commentary piece, which is about 1,000, 1,500 words, and writing it up in a way which is very unique for other researchers to look at. So maybe a researcher in a certain country will look at your commentary paper and conduct a study because you gave them an idea. So this is a low impact research in the bigger scheme of researches, but it's a quick way to publish and have your name out there. And some journals might issue certain invitations where they're looking for certain topics to be published. And we'll be sharing more of those in this program as well. But you don't have to wait for an invitation. You can directly still submit your own papers and have them published. Another very exciting way of publishing research, and this is an upcoming methodology, is social media analysis, which means that you look at existing social media platforms like Twitter to conduct a research study, which could involve studying hashtags. So there are certain hashtags. If you're familiar with Twitter, you would understand that certain researchers and communities use certain hashtags when they talk about a certain topic. It could be about critical care or cardiology or artificial intelligence in medicine. And once you have a certain hashtag, this hashtag is like a footprint. It leaves behind a trail of tweets and content, which can become data which you can analyze. And using this hashtag, you can conduct research studies which look at How many people tweeted about this topic? How impactful was it? Did it have enough awareness around? And eventually, a topic like this with a strong hashtag presence can be published in major journals. As you can see, the first paper on the left is a paper which looked at promoting research, awareness, and discussion on AI in medicine using hashtag #MedTwitterAI. So this was a hashtag that I created on my own. And through enough awareness, this became a popular hashtag on Twitter. So that's one way to have a hashtag out there. You create your own if you think it's not there, or you can study hashtags that already exist and you can publish about them. So this particular paper was published in the Frontiers in Public Health Journal. You've got another one in Current Research in Biotechnology. And this is very exciting for journals because up till this point, this way of conducting research was not there because we didn't have the right platforms, the right softwares, and now we do. So you have a chance to work on this without actually needing an ethical approval and still making a publication in your field of interest. So do consider social media research topics as well. And for that, you need to have your own presence on social media to be able to learn what hashtags are popular. So this is why our recommendation is that if you're at any stage of your career, have a social media account, use it for scientific purposes, and you will go a far way, both in terms of publishing research, but also having a presence in the scientific community. Another very interesting way and a very popular methodology in our program would be looking at systematic review and meta-analysis papers. So in this particular case, this was a paper published by Dr. Kashyap and his team, where they looked at the outcome of adverse events and medical errors in the intensive care unit. So a systematic review in that sense would be conducted in a case where there is enough literature out there. Maybe we don't have a problem with the knowledge of the research gap, but there's not a review done, a systematic review done, which summarizes all these papers that exist online and shows us findings that are based on what already exists. Because we've got a lot of researchers out there conducting primary research, which is collecting the main data itself, but not enough who are using these papers and summarizing them in a systematic way to conduct and give even better results. Because now you're not looking at the power of one paper, but hundreds and thousands of papers giving a strong result. So a systematic review and meta-analysis would be a very interesting way for you to use a remote approach to your study. And in terms of the research impact, it follows one of the highest levels of research you can conduct. And research is never limited to a very medical or a scientific field. It could be relevant to any topic. And this was a very interesting paper, which was in the Journal of Health Economics, which was looking at mortality and immortality in people who win Nobel Prizes. And even though none of us have won a Nobel Prize yet, this paper showed that people who do win a Nobel Prize actually live longer than others by a couple of years. So this is just an interesting idea to show that your research idea doesn't have to be a very stereotypical healthcare hospital-focused research, but something as novel and interesting yet unique like this could bring out a publication on its own. So do not look at yourself as someone who's limited by medications and diseases only. I think there's a lot more to science and healthcare that we can make an impact in. So we've looked at the approach to conduct research. We've looked at certain examples as well. How about avoiding certain things in research, which maybe are obvious to you, and some may be red flags to approaching research studies in your career? So the first thing is really not to consider extremely broad topics. And this is a common struggle that we find. And it's okay, I think, in the beginning of your research topic and idea generation. In the beginning, you start broad, you start open-ended, but then through your refinement of the research idea, you will realize that the more narrower and unique you make it, the more interesting it will be to journals as well. Because when it's a very broad topic, chances are it's already published in different journals, and that decreases your chances of publication in that journal. It's better to avoid a topic that's extremely repeated, and that could be in the form of maybe if the paper is looking at COVID in patients who are adults. This is a topic that may be very streamlined at this point, and you have to consider the hype that exists as well. So there was a time where COVID-19 based papers had a lot of acceptances, and at a point where your research idea may not be as interesting, but because it's on a topic that's very interesting, it became publishable very easily. So you have to be okay with moving on from some very repeated topics. But one way to actually cover that gap is maybe that topic was published in a certain time frame. So systematic review paper may have been done covering the years 2000 to 2015. And that's okay. Maybe your research topic could repeat the same methodology from 2016 to 2022. So in that case, you may be repeating a topic, but you're still advancing science. So in terms of relevance, it still has a publishable element to it. But if you're repeating the exact year, the exact methodology, that will make it a waste of time and energy because a journal will already have it published. So this is where doing a good literature search is very important, because often we find people not doing it well, jumping to a research topic, thinking they've got the best topic in the world. And then maybe 3 months down the lane, they realize, oh, this topic was already published and I'm just repeating the same work again. And of course, it shouldn't be irrelevant to current science. And even more importantly, make sure your topic is following the Hippocratic Oath itself to medicine that we're all accustomed to, which is do no harm. Because a topic that is going to have an influence on the community or an influence on your career will stay as a publication for life. It's a stamp that will not be removed no matter where you go in your future careers. So even though some topics may be interesting to you, question it enough. Is this of any harm to my own career? Will this come back to me in a way which will affect my opportunities in the future? And is this controversial or political in a way which may harm the community potentially? So I try my best to avoid topics that might be highly political or are looking at a certain topic that doesn't have enough of an evidence base to say that it's a problem in science. So that is an important element in terms of the do's, the don'ts that you'd consider. And in terms of upcoming opportunities as part of the GRRSP program, at this stage of when this recording was done, we are sharing a few opportunities that, along with your primary projects, you would be very excited to be a part of alongside. So the first one would be a book authorship opportunity, which is an ongoing work in progress in the background, where we're looking to have a research handbook written up by our own GRRSP scholars or alumni, with the help of our senior professor, Dr. Surani, whose recording you may have heard previously on this channel. And this book would essentially contain all the basics of how to start your own research, how to go through it, any lessons, tips, and tricks. And you have the option here to be an author in terms of a certain chapter or a certain topic that you might be interested to publish in. Another opportunity, which is on the topic of breaking the mental health stigma of eating disorders, is a special collection by the Frontiers in Psychiatry journal. And Dr. Kashyap is one of the guest editors in this case and would be happy to discuss further in terms of any case reports, original articles, editorials that you might be interested to write on this theme. Another topic that I will be leading currently, which is a work in progress, is a global psychiatric needs assessment survey. So as you may have seen, a critical care assessment survey looking at the ICU needs around the world, a similar psychiatric needs assessment survey is planned to be conducted in the future. So if this is something you're interested in, you can reach out and we can build this together. And last but not the least, I think it's important that when you're building your idea, try to keep a lookout for upcoming conferences as well, because this way your research paper will have its own work in progress as a project which you will mention in your CV, but why not get more out of it in the form of abstract submissions to certain conferences? And the only way you can know that is to keep a lookout constantly. For 2023, what are the upcoming conferences? So we've got the CHEST conference coming up. You've got the Emirates Critical Care Conference and other fields as well, which will have their own conferences around the world. So do make sure that whatever topic you're interested in, maybe there's a conference or two in different parts of the world that you can submit it to, and that will look as a nice, interesting topic on your portfolio as well. I'd like to conclude this talk by having a lesson for all of us, which is that great leaders are not the best at everything they do. What makes them great leaders is that they find people who are best at different things and get them together on the same team. And that's what we'll be doing over the course of the 6 months program. We'd be working with certain strengths and skills that you can use from each other and utilize and grow together. And that will essentially make you a great leader by the end of this program. So if you don't understand a certain thing in research, that's okay. It shouldn't stop you from starting your journey, from starting your projects, but make sure you're utilizing, you're communicating, you're engaging with people who are going to be great leaders with you as part of this program. Thank you very much. And we're ready to conclude this talk and at the same time have an open-ended discussion on your own research ideas so far.